I want to raise health inequalities of Gypsy, Roma and Traveller communities. People from these communities live an average 12 years less than the general population. So, as we've been discussing, a really stark inequality. And groups tell me it's really difficult to monitor the health outcomes, as the NHS directory doesn't define Gypsy, Roma or Traveller in terms of an ethnicity, and the ONS census just asks if health is poor or very poor. The health inequality strategy only mentions GRT people as an example of a marginalised group with poor health outcomes, and the last implementation plan doesn't mention them at all, and neither does this current one. So I just wondered if you could speak to what you're doing for the GRT community, and specifically to address the disaggregation of data about their health and their needs.
I'm going to ask Vicky to comment on that, because she's got a degree of expertise in that area. Thank you.
Yes, thank you for the question. So first of all, to acknowledge the need to address the needs of different communities in London, including this community. I personally worked with the community many years ago in terms of a project for children in temporary accommodation and homelessness. So I'm well aware, that was a few years ago now, but I'm well aware of some of the issues. I'm not going to give a trite answer. The health inequality strategy is not, it is a strategic implementation plan. It's looking across. I think what my unit is doing, so the public health unit, in supporting other teams in policy development, is looking at how do we pick up the needs of different communities from a health inequalities perspective in the policy work that's being taken forward, as well as within the partnerships that we work in, how are the needs of particular communities being picked up. So I'm happy to follow up with that with a little bit of further information. One thing I do know most recently, and it's slightly coming to mind, is in terms of the London plan and the work they're doing around fixed sites and the needs for those, which from a public health unit perspective would sit alongside other areas of housing need that we're looking at, but recognising there are particular and specific needs for different communities.
Yeah, I think it would be really good to kind of capture that in some of, in these strategies, because obviously the things we've spoken about in terms of suicide, mental health, experience of the housing crisis is acutely felt for this community. A suggestion from a group that I've met, and it's interesting you talk about policy work in other areas, is around the lack of we know that the environment is a huge factor, and I know you spoke about this earlier, Tom, about how medical professionals only contribute to about kind of 20% of someone's health outcome. So this is about the environmental hazards. So often the sites are under flyways, or within, view of the remains of Grenfell. So this group's raised if you could commit to an inquiry into the current sites and their proximity to significant environmental risks, specifically for this community.
I mean, I can't commit to an inquiry in the role that I'm in, but I'm certainly happy to look into it.
That would be great, because site, obviously we know that site placement is a real issue, and it can be seen as environmental racism that this group is kind of excluded and having to experience these kind of extreme kind of environmental hazards. I want to go on briefly, and I know, Tom, you won't be surprised I want to speak about drugs. So we're very aware of the synthetic opioids in the drug supply since 2023, but usually these synthetic opioids that are obviously can be up to 5 times more toxic and potent and harmful than heroin. We know that these synthetic opioids have been found in the heroin supply but are now creeping into the supply of other drugs, and you will be aware that 2 people died last week. It's thought that they were buying ecstasy, consumed a quarter of the pill, and 2 people died because of the synthetic opioids being found in that drug, which is incredibly distressing and tragic. So I wanted to know how you all share information about drug alerts and about harm reduction information, and maybe Jazz specifically around schools, because I was at the OHID event yesterday, which I was going to say to Kevin that I thought was brilliant, that his team organised a really great event for clinical leads of drug treatment services. But that was a real concern, that these drug alerts just aren't getting out, and especially to young people.
Thank you, Zoe. And it's the impact of nitrazines, which is the new synthetic opioid, which is just so toxic. And it is increasing in London. And so, as a GP, as an example, and I always test out when people say, we send out alerts. I think, well, did I get it as a GP? And I did. So therefore, the alert system does work. So it's cascaded. You're often down to the borough. then the borough sends it out to all the appropriate health professionals. As the GP, I got it in Wandsworth at my practice email address earlier this week. So therefore we are getting those alerts. Whether it's as effective as we'd like it to be, that's another issue. And also OHID, and I'll ask Vicky to talk in a minute, are the lead on this work. And Kevin obviously is on the London Drug Forum, and where we try to get a collaborative approach between ourselves, the police service, the drug and alcohol service, the probation service, etc., to how do we combat drugs in London, because it is a significant issue. And what we don't want to do is get into that American situation whereby opiate deaths are just colossal. In London, we're trying to contain them by having as many checks that are legally possible to do to alert ourselves, the drug users, but also the health professionals.
So just looping back on the alert systems, we've done a lot, as you probably picked up in this event, and for wider Assembly members that are maybe slightly not as involved, intelligence about drug-related harm comes through different agencies, ambulance service, police, can also come up locally, etc. The responsibility around drug and alcohol treatment sits with local authorities, and they play a key role in coordinating around drugs.
I'm just aware of my time, and I was really keen to know how we get those alerts to people, like how we use social media, how we're using. So it's great that GP practices are getting it, but it's how we're actually getting that to people.
What we have to, the strategy around that is carefully. So I won't go into, in the GLA Public Health Unit, very involved in this, crafting that messaging carefully, because you're often in a situation where you don't have the complete information. You don't want to give out information that is potentially going to take people down a different path. There is a comms group looking at that in terms of that incident management, and it's something that we are in very, very, very close contact with MOPAC on, as well as OHID, to make sure we get joined up messaging.
Great, because I know there's some great work from drug treatment services about sharing the availability of naloxone, and just the more we can do as a health system with all of our contacts, the better. Thank you. Sorry, I'm out of time.